Think about this for a second. There's this tiny, almost invisible gene, just one, on a single chromosome, and it acts like a master switch. It can completely redirect a horse's entire biological development, turn what should be one thing into something totally different. I mean, that's an incredible level of precision. And, well, when it goes even slightly wrong, you get some really surprising outcomes in the animal kingdom. Welcome to the deep dive. Today we're taking a plunge into a fascinating and, pretty complex area, equine sexual development disorders, or DSDs. This deep dive, it's all about understanding what happens when that intricate, precisely timed process of sexual differentiation in horses kind of veers off the normal path. Our mission today, well, it's pretty straightforward. We're going to unpack these complex biological conditions. We want to understand their causes, what they actually look like, and how they're diagnosed and managed, all without getting totally lost in the heavy science. Think of this as your fast track to being really well informed on a niche, but honestly profoundly interesting subject. You'll find some truly surprising insights along the way. We've pulled from detailed excerpts of veterinary text on equine sexual development and its disorders, just to give you a really comprehensive view. So, okay, to really get what can go wrong, we first need to understand how sexual development normally unfolds. In mammals, including horses, it's a precise sequential thing that happens on like 3 distinct levels. First up, there's genetic or chromosomal sex. That's decided right at fertilization, XX for female, XY for male. Simple enough. Then you've got gonadal sex. This is where the fetal genital ridge, this little bit of tissue, turns into either testes. If that critical SRY gene on the Y chromosome is present, or ovaries if it's absent. And finally, there's phenotypic sex. This is the actual development of the internal bits and the external genitalia. And that whole process is controlled by the gonads that just developed and how the body responds to their hormones.
Yeah, and what's truly remarkable there is just how precise that sequence is. That tiny SRY gene on the Y chromosome, it's not just important. It really is like a master switch. It kicks off the whole cascade for testicular tissue to develop. And what's really interesting is, well, there isn't really a single female development gene that does the opposite. Female development sort of happens by default, in the absence of that male switch.
Right, so the SRY gene flips the switch for male development. But once that switch is flipped, or, not flipped, what else has to happen? What's the sort of hormonal choreography playing out?
That's a great question. It's a very delicate dance of hormones, really. In males, you have testosterone from certain cells, the Leydig cells. That hormone supports the development of the Wolffian ducts, things like the epididymis, vis deferens, which are crucial for sperm transport later on.
Okay.
And at the same time, another hormone, anti-Müllerian hormone, or AMH, from different cells, the Sertoli cells, actively tells any potential female structures, like the tubes that would become oviducts and the uterus, to just regress, to go away.
There's an active suppression.
Exactly. It's an active process. In females, it's actually simpler in a way. Without those male hormones, AMH and testosterone, the female structures, the Müllerian ducts, just naturally develop. And the male ones, the Wolffian ducts, they just regress because there's no testosterone signal. And then the final appearance, the external genitalia, whether it's a vulva or a penis and scrotum, that's shaped by other androgens, other male hormones like testosterone and dihydrotestosterone.
Okay, got it. So with that foundation now, let's dive into the really interesting part. What happens when something veers off course? At any of these levels, genetic, gonadal, or phenotypic. That's where we start seeing these disorders of sexual development. We sometimes hear terms like intersex or hermaphrodite. Technically, that means both testicular and ovarian tissue are present in the same animal, which is pretty rare.
Very rare.
Then there are pseudohermaphrodites. In these cases, the genetic sex, the chromosomes, the gonadal sex, the testes or ovaries actually match up. But the external genitalia look, well, ambiguous.
Yeah.
And we categorize them by the gonad that's present. So a male pseudohermaphrodite has testes, but maybe ambiguous external parts. And a female pseudohermaphrodite has ovaries, but again, ambiguous or masculinized external appearance. Okay, let's start with errors right at the beginning, the genetic blueprint, the chromosomal level. These are the disorders of genetic sex. Often this means there's an abnormal number of sex chromosomes, like the most common one leading to infertility in mares is 63XO, sometimes called X monosomy. This just means the mare is missing an X chromosome. She only has 1 instead of 2.
Yeah, and this single missing chromosome leads to a whole range of issues. Clinically, you might see mares with underdeveloped ovaries, what we call ovarian dysgenesis. Their internal reproductive organs, the tubular genitalia, they might look infantile, like they haven't fully developed. These mares are often a bit smaller than average, maybe don't perform as well athletically, and crucially, they're infertile. Phenotypically, they look female, but it's somewhat similar to Turner syndrome in humans.
It's really astonishing, isn't it? The precision needed means just one tiny error. A single missing or extra X or Y chromosome can completely redirect the animal's development. I mean, that's the core insight here, I think. The blueprint is incredibly delicate.
Absolutely. And its fragility has these profound real-world consequences for the horse. Take 65,000 XXY horses, for example. That's kind of like Klinefelter syndrome in humans. These horses look male, phenotypically male, but they have really small, underdeveloped tests, hypoplastic tests, and they're always infertile.
Always infertile.
Always. Or you might see 65,000 XXX mares. Externally, they often look just like a normal mare. You might not notice anything. But internally, they also have gonadal dysgenesis, underdeveloped gonads, and they're infertile too. So yeah, these subtle genetic changes have this big cascading effect.
And it's not just about the number of chromosomes, right? There can also be structural problems.
Exactly. You can have deletions where part of a chromosome is missing, or duplications where part is copied, or even exchanges, fusions, inversions. All sorts of structural rearrangements on the sex chromosomes can cause problems.
Okay. And maybe just quickly clarify, chimeras versus mosaics. Those terms pop up sometimes.
Good point. They get mixed up. A chimera has distinct cell populations that actually came from two different original fertilized eggs, two different sources that somehow merged early on. It's actually quite rare in horses because of how their placentas usually develop separately.
Ah, okay.
A mosaic, on the other hand, is more common in DSDs. Here, you also have different cell populations, but they all came from a single fertilized egg, a single genetic source. The differences arise because of errors during cell division, like chromosomes not separating properly as the embryo develops. And these mosaics often lead to ambiguous sexual differentiation.
Right. So we've covered errors in the genetic blueprint. But what if the genes, the XX or XY, are correct, but the gonads themselves don't develop as expected? That takes us to disorders of gonadal sex, or what are sometimes called sex reversal syndromes, where the gonad type doesn't match the chromosome type.
Exactly. So for instance, you can have a horse that is genetically male, 64XY, but it develops no testes. Instead, where the testes should be, you might find a small inactive ovary or maybe just a streak of undeveloped gonadal tissue. The result is a horse that looks and often acts like a mare, but she won't cycle, she won't come into heat, she's infertile. We classify her as an XY female.
Okay, an XY female. And what about the reverse? Can a genetically female horse end up with male gonads?
Precisely. You can have a genetically female horse, 64XX, that actually develops testicular tissue. Now, this can be a whole spectrum. It might be varying degrees of testicular development, maybe mixed tissue. Or in the most extreme cases, you can have what looks like an XX male with, bilateral tests, fully formed tests, despite having XX chromosomes. Or, in some other cases, you might get a true hermaphrodite with ovotests gonads containing both ovarian and testicular tissue. Again, the key factor here often comes back to that SRY gene. Its presence, its absence, or its proper function is just crucial, sometimes overriding the XX or XY background. It really shows how powerful that single genetic switch is.
It really does. Okay, and the final category then is disorders of phenotypic sex. So here the genetics, XXXY, and the gonads, ovaries, testes, are aligned. But the problem lies in how the internal plumbing, the tubular structures, or the external genitalia actually develop.
Yes, exactly. This can include conditions like hypospadias or epispadias. Hypospadias is where the urethra, the tube for urine, opens abnormally on the underside of the penis, not at the tip.
Okay.
Or you can have something called testicular feminization, which is, well, it's particularly intriguing. In these cases, you have a horse that is genetically male, XY, and has testes. But its body tissues, the target organs, they can't properly respond to the male hormones, the androgens, like testosterone, that the testes are producing.
So the signal is sent, but not received.
Precisely. So, despite having tests pumping out testosterone, their external genitalia develop looking female. It's a complete mismatch between the internal reality and the external appearance.
Okay, so that's a lot of complex biology. What does this actually mean for a horse and its owner on the ground? Let's zoom in on some of the DSDs vets encounter more often and what the signs might be. Generally speaking, if you're dealing with a DSD, the big red flag is usually infertility or outright sterility.
Right. That's the most common presenting complaint, yes.
Owners might notice, a horse just failing to show the right reproductive behavior. Maybe it's a mare that seems to be in heat, flags her tail, but just won't stand to be mounted by a stallion. Or a stallion with a perfectly normal libido seems interested, but produces no sperm mesospermia.
Sometimes you might even observe attraction to the same sex, which can be a clue, though obviously not definitive on its own.
And then a physical exam by a vet can often reveal clues too,
Yeah.
external things.
Definitely. Externally, you might find an abnormally enlarged clitoris in what appears to be a mare, or hypospadias in a male, maybe cryptorchidism, the retained testicle, or an underdeveloped scrotum. Internally, using palpation per rectum or ultrasound, we might find things like an ovotestis or abnormal ducts that shouldn't be there.
Okay, let's talk about XY sex reversal then, sometimes called XY mares.
Yeah.
You mentioned this is one of the more common DSDs.
Yes, it's relatively common. These are horses that are genetically male, 64XY, but they look female, phenotypically female.
So easy to mistake for just a regular mare initially.
Very easy. And that's the challenge. Often they appear completely normal externally. The underlying issue is usually a deletion or a mutation of that critical SRY gene. So because the SRY signal is missing or faulty, their gonads don't develop into testes. Instead, they form abnormal inactive ovaries or just these streak gonads, basically non-functional tissue.
And the main sign for the owner is?
The main sign is infertility. They usually fail to show estrus. They don't cycle because their ovaries are inactive. Occasionally, some might have a slightly enlarged clitoris or maybe even show some intermittent male-like behavior, perhaps if there's some residual disorganized testicular tissue producing a bit of hormone. But infertility is key.
Right. And then there's X-monosomy, the exomares, CC3XO.
Yes, and this one is actually the most common chromosomal abnormality we find that causes infertility in mares.
So even more common than the XY mares.
In terms of diagnosed chromosomal issues leading to infertility, yes. These mares have only one X chromosome, and because of that, they are typically infertile. Their ovaries are usually very underdeveloped, dysgenetic, and they lack the follicles needed to mature and release eggs. Externally, they generally look like normal females, although they might be noticeably smaller than average. The big clue, again, is reproductive failure. They usually fail to cycle altogether or maybe have very irregular week cycles.
Okay. Now, what about cryptorchidism, the retained testicle? You said this is the most common DSD in male horses.
It is, by far. It's simply the failure of one or both tests to complete their journey down into the scrotum during development. They can get stuck up in the abdomen or partway down in the inguinal canal.
And it's important to remember, this is different from the chromosomal issues, right? The horse is genetically and gonadally male, XY with testes.
Exactly. It's primarily a developmental problem with the descent mechanism, not the initial formation of sex. But it's still classified as a DSD, and it's significant because it's common and definitely heritable.
Heritable is a key word there. So what are the practical implications?
Well, it depends if it's one or both. If a horse is unilaterally cryptorchid, one testes down, one retained, he can still be fertile from the descended testes. But, and this is crucial, he absolutely should not be bred because he'll pass on that tendency for cryptorchidism.
Right. Ethical considerations.
Yeah, definitely. Now, if he's bilaterally cryptorchid, both tests retained, he's usually sterile. The retained tests are kept at body temperature, which is too warm for viable sperm production. However, and this is a big however for management, those retained tests still produce testosterone. So these horses typically exhibit strong, often difficult to manage, stallion-like behavior.
That's a really great point. It makes you think, doesn't it, why some of these conditions like cryptorchidism or maybe those XY mares, they can look outwardly normal for quite a while. You know, the owner might not suspect anything until they actually try to breed the horse, or maybe the behavior becomes an issue.
It really does underscore the hidden complexities, doesn't it? What you see on the outside isn't always the full story when it comes to these intricate developmental paths.
No, definitely not. Okay, and lastly in this group, hermaphroditism and pseudohermaphroditism. This is where things get really ambiguous externally.
Yes. This category covers horses with mixed or ambiguous sexual characteristics. A true hermaphrodite, possessing both ovarian and testicular tissue, often combined in an ovotestis, is actually very, very rare in horses.
Extremely rare.
Okay. More commonly, you might encounter pseudohermaphrodites. So a male pseudohermaphrodite is genetically male, XY, with testes, but their external genitalia look feminized or ambiguous. This might be due to defects in androgen synthesis, making the hormones, or problems with the body's receptors for those hormones, like that testicular feminization we mentioned.
Right, the signal isn't received properly.
Exactly. And then a female pseudohermaphrodite is genetically female, XX, with ovaries, but her external genitalia look masculinized or ambiguous. This is usually caused by exposure to androgens, male hormones, during a critical window window of fetal development. Also very rare in horses.
And clinically, what does this ambiguity look like?
It's quite varied. You might see an enlarged clitoris that resembles a small penis, maybe an underdeveloped or abnormally located scrotum. Hypospadias is common in male pseudohermaphrodites. These horses are almost always infertile, and their behavior can be quite ambiguous too, sometimes leaning male, sometimes female, sometimes just confused.
Wow. Okay, so faced with these possibilities, how do vets actually figure out what's going on? It sounds like some serious diagnostic detective work.
It really is. It's a comprehensive approach, absolutely. You need that detective's eye, but also, the cutting-edge science to back it up. It always, always starts with a thorough clinical history. You need the reproductive history, behavioral history, developmental milestones. And for conditions like cryptorchidism, the breeding history of the parents, if known, can be really important because of the heritability.
Okay, history first, then the physical exam.
Then the physical exam, yes. A careful inspection of the external genitalia for any abnormalities. Size, shape, position of everything. And then internally, using rectal palpation and, crucially, ultrasonography, we assess the internal reproductive organs. We're looking at the ovaries, the uterus in apparent females, or trying to locate the position and size of testes, whether they're descended or retained. Ultrasound is key here.
And hormone tests seem critical, especially for figuring out what kind of gonadal tissue is present.
Absolutely central. Measuring baseline testosterone is a starting point. Often we'll do an HCG stimulation test. HCG mimics a hormone that stimulates the testes, so if testosterone levels jump up significantly after giving HCG, it strongly indicates there's active testicular tissue somewhere.
Even if you can't find it easily.
Even if you can't find it easily. But maybe even more useful nowadays is measuring anti-Müllerian hormone, AMH.
Yes, you mentioned that earlier. Produced by the Sertoli cells in testes.
Exactly. Its presence, especially elevated levels in a horse that looks like a mare, definitively points towards Sertoli cell activity, which means testicular tissue. It's often more sensitive than testosterone for picking up cryptorchids or XY mares.
So if you have a mare that just won't cycle, looks normal, but her AMH comes back high, that's a huge red flag for hidden testes, like an XY mare, or maybe an ovotestes.
It's a massive clue. I remember this one case, a lovely performance horse, looked like a mare. Owner was baffled why she never cycled. Everything else seemed normal. We ran an AMH and bam, it was sky high. Turned out she was an XY mare with abdominal tests. That single test really cracked the case and changed the whole management plan. It helps pinpoint that underlying gonadal reality.
That's fascinating.
And of course, we also look at estrogens and progesterone levels to assess if there's any normal ovarian activity happening.
But the real sort of gold standard for nailing down the genetic sex is looking at the chromosomes themselves.
That's right. Chromosomal analysis, or karyotyping, is the definitive test for sex chromosome abnormalities. It involves taking a blood sample, culturing the white blood cells, and then preparing them so we can actually visualize and count the chromosomes under a microscope. This tells us definitively if the horse is 64XX, normal female, 64XY, normal male, or something abnormal like 63XO, 65,000XY, or a mosaic.
Okay. You can also test specifically for the SRY gene.
Yes, PCR tests can detect the presence or absence of the SRY gene itself, which is particularly useful for confirming suspected XY mares where maybe the SRY gene is missing or mutated.
And sometimes, I guess, you might need to actually get a piece of the gonad itself.
Occasionally, yes. A gonadal biopsy, or more commonly, examining the gonad after surgical removal, gonadectomy, allows for histopathology. Looking at the tissue under a microscope confirms definitively whether it's ovarian tissue, testicular tissue, or maybe an ovotestis with both.
Right. So you've done the detective work, you've got a diagnosis. What happens next? How are these conditions managed? It sounds like the focus shifts away from breeding pretty quickly.
Almost always. The management really centers on the horse's long-term health, welfare, and its potential role beyond breeding. Most DSDs result in infertility, so breeding is generally off the table. That means comprehensive and, importantly, empathetic counseling for the owner is crucial. We need to discuss the genetic implications affected animals shouldn't be bred, and often their parents shouldn't be either, especially for things like cryptorchidism. And always, the horse's welfare comes first in any decision.
Okay, so what about specific strategies? For cryptorchidism, the retained testicle, what's the usual approach?
The standard and generally recommended treatment is surgical removal of all testicular tissue, both the descended one, if any, and the retained one. This is called cryptorchidectomy. This eliminates the stallion-like behavior, which is often the main reason owners seek treatment for bilateral cryptorchids. It prevents them from passing on the heritable condition, and importantly, it removes the increased risk of tumors like seminomas or teratomas developing in those retained tests later in life.
Right, that tumor risk is a big factor. What about the XY mares? The genetic males that look female and are infertile.
For XY mares, since they're infertile, the main reason for intervention is usually to remove those abnormal dysgenetic gonads. A gonadectomy? Why? Well, partly to prevent any potential, though maybe low risk of tumor development in that abnormal gonadal tissue, and also to reduce or eliminate any residual male-like behaviors they might occasionally show. The really good news is that after gonadectomy, these horses can typically lead perfectly normal, happy lives as performance horses or companions.
That's great to hear. And the exomares, the infertile ones missing an X.
For exomares, there's no specific medical treatment for the chromosomal condition itself. They are infertile, and that can't be changed, but they generally don't have major health issues related to the exo status, aside from maybe being a bit smaller, so they can usually have perfectly normal careers as performance or companion horses, too. Athletic potential might just be slightly different due to size.
Okay, it really does connect back to that bigger picture, doesn't it? While DSDs sound complex and maybe even a bit daunting,
They can, yeah.
the diagnostic tools we have now and the management options mean that many of these horses can still lead really full, productive lives. The focus just shifts, like you said, from reproduction to performance or companionship. That must be a powerful message for owners.
It absolutely is. It's not always a diagnosis that limits the horse's quality of life or usefulness, just its reproductive potential.
Right. And what about the horses with ambiguous genitalia, the hermaphrodites or pseudohermaphrodites?
Management there can be more complex and individualized. Sometimes surgical procedures might be considered, maybe for cosmetic reasons if the abnormality is causing issues, or for management like making urination easier if there's hypospadias. Gonadectomy, removing whatever gonadal tissue is present, testes, ovaries, or ovotestes, is often recommended. This helps reduce abnormal hormonal influences, eliminates problematic reproductive behaviors, and again, prevents potential tumor formation. Depending on the horse and the specific condition, ongoing behavioral management might also be necessary.
And long-term health monitoring is probably wise for many of these.
Definitely. Especially monitoring for any signs related to tumor risk if gonads weren't removed, or managing any ongoing behavioral quirks. And honestly, these cases can get pretty complex. Referral to veterinary specialists, particularly those in the aerogenology, reproduction, and genetics, is often really beneficial for getting the most accurate diagnosis and the best management plan.
Makes sense. Well, that brings us towards the end of our deep dive into equine sexual development disorders. It really is a fascinating area, isn't it?
It truly is. So intricate.
We've kind of journeyed from that precise dance of normal development through all the varied ways it can go slightly awry, and looked at how modern veterinary science helps diagnose and manage these conditions. Hopefully you feel like you've gained a really nuanced understanding now, that shortcut we promised, to being well-informed on this unique aspect of equine health. Considering just how intricate that genetic and hormonal orchestration has to be for normal sexual development, and thinking about the, frankly, myriad ways it can be disrupted by just one tiny change. It really makes you wonder, doesn't it, what other subtle biological switches might exist, in other species or even in other systems within the horse, dictating critical aspects of their very being that maybe we're only just starting to scratch the surface of understanding.
That's a great thought to end on. There's still so much we're learning.
Absolutely. Well, we encourage you to keep exploring, keep questioning, and keep diving deep. Thanks for joining us.